Hi everyone. I wanted to take a moment to talk about heartworm, fleas, and ticks to make sure you have the most up-to-date information for making decisions on testing and prevention for your furry friends heading into this upcoming heartworm season. Let's start by talking about heartworm disease. Heartworm is a life-threatening disease caused by a parasite which can affect a number of mammals, including dogs and cats. Heartworm is transmitted by everybody's favorite spring and summer pest, the mosquito. Heartworm gets its name because in the later stages of the disease, the worms will live predominantly in the pulmonary arteries and the heart. If left untreated, heartworm disease can be fatal. Okay, so we know heartworm is transmitted by the mosquito, but what exactly is its life cycle? Well, it all starts when a mosquito bites an infected animal and takes in the larval form of heartworm. In ideal environmental conditions, that larvae will continue to develop inside the mosquito over a period of 2 to 3 weeks. At that time, that infected mosquito will then transmit the infective larvae to another dog. Inside that infected dog, the parasite will continue to develop and migrate to the heart and pulmonary arteries 3 to 4 months after infection and will reach mature adulthood and reproductive age at 6 to 7 months after the initial infection. What exactly is the difference between a heartworm infection and heartworm disease? Well, the easiest answer is time. A heartworm infection occurs when an infected mosquito deposits immature larvae into your dog during feeding. A dog with a heartworm infection will show no symptoms and is not clinically ill. This is the stage we aim to identify during annual heartworm testing and is the easiest and most successful stage to treat. On the other hand, heartworm disease is used to describe later forms of the disease when the dog is showing clinical signs. At this stage, treatment is much more difficult, costly, and the outcome is much less predictable. High doses of pharmaceuticals will be used for treatment, and they are much more likely to cause side effects than those used for prevention. What are the symptoms of heartworm disease, you ask? Well, dogs will develop symptoms of the disease due to the presence of adult heartworms in the pulmonary vessels, lungs, and heart. These symptoms may include exercise intolerance, mild to severe coughing, weight loss, labored breathing, and eventually heart failure. Heart failure can be identified by abdominal swelling, heart rhythm irregularities, weight loss, fainting, and even sudden death. What is the risk of your dog getting heartworm in Ontario? Well, the latest statistics show that the greatest risk of infection is south of and around the 403, 402, 401 corridor that runs between Sarnia and Hamilton. This is where 80% of all cases in Ontario occur. Why is our minimum heartworm recommendation annual testing? This is because annual testing allows us to diagnose an infection early, which greatly increases the success of treatment. Identification of infected dog also helps us to stop the transmission of disease to other healthy dogs. When is heartworm testing recommended in southwestern Ontario? If there has been seasonal potential for exposure, all dogs over 6 months of age should be tested for heartworm annually. If your dog is over 6 months of age, testing for heartworm is required before starting any heartworm prevention medication. Since it takes 6 months for a dog to develop a positive response on a heartworm test, we recommend that annual testing begin no earlier than 6 months after the end of heartworm season of the previous year, which is usually considered to be October 15th here in southwestern Ontario. Puppies born after October 15th may not need a test the following spring, depending on weather patterns seen in late October and November. We simply put them on heartworm prevention for their first summer and perform a heartworm test the following year. A couple of final thoughts to consider as you decide whether to put your dog on heartworm prevention medication or what prevention medication to use. Heartworm infection is easier to prevent than to treat. Treatment is not without risk, requiring close monitoring, is costly to administer, and often requires hospitalization. In the province of Ontario, heartworm preventatives are administered for 6 months beginning June 1st. Unfortunately, at this time, there are no natural methods of preventing heartworm that have been proven to be as effective as pharmaceutical preventative medications. Now that we reviewed heartworm and its disease, let's move on to some fun facts about fleas. Adult fleas are wingless insects that are generally smaller than a sesame seed and feed on the blood of animals. They have extremely large, long back legs that give them an extraordinary ability to jump. They hang on to our pet's fur with their claws and use needle-like mouthparts to bite through the skin in order to suck up blood, sometimes in quantities of up to 15 times their body weight daily. Fleas can cause intense irritation to you and your pet. They can transmit parasite infections such as tapeworms to your pet and can cause anemia in young, older, or ill pets. Some pets may be allergic to flea bites, known as flea allergy dermatitis, resulting in red, irritated skin and hair loss. What is the life cycle of a flea? Well, a flea's life cycle can be broken down into 4 parts: the egg, the larva, the pupa, and the adult. The adults lay their eggs on a host, like our dog or cat, and then those eggs roll off into the environment. The eggs will remain in the environment until they hatch into larvae, and those larvae will hunker down in the environment, feed, and go through several molts until they spin a cocoon and become a pupae. Eventually, from the pupae emerges the adult fleas, which then seek out the animal host to feed. This entire process generally takes about 21 days. However, fleas have a very flexible life cycle and will wait until conditions are optimal to move from one stage to another. The more warm and moist it is, the faster the life cycle progresses. While we can see a problem with fleas at any time of year, we tend to see a higher number of flea infestations in April and May, and again later on in August and September. When working to prevent a flea infestation in your home, keep in mind that flea larvae are very tiny and can live in the cracks in floors or in the fibers of rugs, blankets, or upholstery. They love the dark spaces beneath couches, beds, and pet beds, and will be found anywhere it is dark and moist. We know that fleas are not the only pests of concern out of doors, so here are a couple of tips to help deter fleas, ticks, and mosquitoes from your outdoor space. Fleas and ticks love tall grass, so keep your lawn mowed and free of leaf litter. Eliminate sources of standing water to help deter mosquitoes. You can try attracting insect-eating birds and bats to your yard by setting up proper habitats. And finally, are you aware that ants are voracious eaters of flea larvae and should not be disturbed outside? That being said, we do understand if you do not want to use them as pest control inside. If you end up with a flea infestation despite your best preventative efforts, here are some tips to help you out. Keep in mind, to fully eliminate a flea infestation, you need to control that on your pet as well as in the environment. This is best achieved by preventing the development of immature stages of fleas using mechanical control measures like vacuuming and the washing of both bedding and the pets themselves, as well as through the use of products containing insect growth regulators and adulticide agents. Revolution kills adult fleas and prevents flea eggs from hatching for 1 month. When used for treatment for fleas, you should avoid vacuuming, as the larval form of fleas eat pet dander containing the active ingredient. The isoxazoline class of drugs like NexGard and Credelio work to kill adult fleas that feed off of a treated pet
for at least 30 days. Due to the flea life cycle, it will take 3 months to fully eliminate a flea problem from your home environment.
Now that everybody has a little bit of the itchy scratchies after talking about a flea infestation, let's move on to the hot topic of the season, ticks. Here are some tick facts you may or may not be aware of. Each female tick lays more than 2,000 eggs. Ticks must dine on blood from whatever host it can, including mammals, birds, reptiles, and amphibians. Ticks need a new host to feed on at each stage of their life. Adult ticks are the size of a sesame seed or smaller before feeding. Nymphs and adults transmit Lyme disease to dogs and humans. Ticks are most prevalent from April to November when nymphs and adults begin feeding. You can only contract Lyme disease from ticks, not from dogs or humans. The black-legged tick is very slow in transmitting the bacteria causing Lyme disease to dogs. It takes an average of 24 to 48 hours. This slow transmission of disease demonstrates the importance of checking your dog for ticks after being outside. What does the life cycle of a tick look like? In most ticks, it takes 2 years to complete the 4 stages of their life cycle. In simplest terms, the life cycle begins with the female when she lays her eggs in a protected area of grass. 6-legged larvae hatch from those eggs and begin to search for hosts to feed on. The full larvae drop off that host and transform into 8-legged nymphs. Those nymphs then look for a host to feed on. When they are full, those nymphs will drop off the host and mature into an adult tick, and that adult tick will then look for a host to feed on, and then move on to reproduce during the fall. The female tick will survive through the winter to lay more eggs in the spring. So how exactly do ticks find their hosts? Well, ticks find their hosts by detecting animal breath, body odor, and by sensing body heat, moisture, and vibration, and some species can even recognize a shadow. Ticks will pick a place to wait by identifying well-used walking paths. Ticks cannot fly or jump, but many tick species will wait in a position known as questing. While questing, ticks hold onto the leaves and grass by their 3rd and 4th pairs of legs. They hold their first pair of legs outstretched, waiting to climb onto the host, and when the host brushes the spot where the tick is waiting, it quickly climbs aboard. Some ticks will attach quickly, while others will wander around looking for places like the ear or other areas where the skin is thinner. We know that the best prevention for tick-borne diseases is to find and remove ticks from your pet as soon as possible. Best practice is to check your pet over at least once daily or after they have spent a period of time in the great outdoors. To find a tick, you need to look for little dark specks moving around on your pet's fur, feel for lumps or bumps, and look for areas that appear irritated. Ticks are drawn to dark, moist areas on the body, including under the collar, under the tail, inside the groin area, under the front legs, between the toes, around the eyes, and under the ears. For those of you with dark-colored pets, it can be very difficult to see ticks moving around. One suggestion is to take a tape lint roller and run it carefully over all surfaces of your pet, as the unattached tick will get picked up by the sticky surface and will easily be removed.
To provide the best form of tick prevention, it is recommended to check your pet over carefully as soon as possible after they have been in a tick-infested area. The black-legged or deer tick is only about the size of a pinhead in juvenile or nymph stage, but is a little more obvious in the adult stage and after feeding. Running a sticky lint roller over your pet is a great way to pick up the small nymph stages and is an effective way to check dark-coated or dark-skinned dogs. If you do find a tick moving around on your pet and the tick has not fed, it should be removed promptly and placed in a jar containing rubbing alcohol. If you find an attached tick, grasp the tick with fine tweezers or a tick twister and slowly and firmly pull it straight out. It is important to protect your fingers from potential exposure to Lyme disease by using a tissue or disposable glove and take care not to crush the engorged tick body during handling.
The two most common types of ticks we see are dog ticks and black-legged or deer ticks. There are a few distinguishing features between the two types of ticks, including color and size, but please be aware it can be very difficult to identify the type of tick you have removed once it has been engorged. Both of these types of ticks have 8 legs. On the dog tick, the males have white colors down their entire back, where the females have white on part of their back. They are about the size of a pencil eraser, and neither of these ticks transmit Lyme disease. For the black-legged or deer tick, they are more around the size of a sesame seed. The female has black and orange-red on her back and can transmit Lyme disease. The male is black down his entire back, and it has been unproven as to whether they can transmit Lyme disease.
When it comes to Lyme disease, it is important to note that it takes 36 to 48 hours after a tick attaches to your pet for Lyme disease to be transmitted. If ticks are found and removed before that time frame, Lyme disease transmission can be prevented. It is also important to remember that all black-legged or Ixodes ticks do not carry the vector for Lyme disease. As of the 2022 research data, only 5 to 10% of infected dogs in Ontario will develop any sign of Lyme disease and will therefore not require any treatment. We recommend tick-borne disease testing each spring in conjunction with annual heartworm testing. The higher risk areas of note are Point Pelee, Rondeau, Grand Bend, Long Point, Turkey Point, and Prince Edward County.
So how is Lyme disease actually transmitted? Well, an infected black-legged or deer tick transmits the bacteria causing Lyme disease through the skin by a strong but painless bite. The tick then secretes a cement-like substance to anchor to its host where it is difficult to remove. It begins to take its blood meal 30 minutes later. Tick bites are painless and non-irritating because their saliva contains an anesthetic to numb and reduce pain, an antihistamine to reduce allergic reaction or itching, an anticoagulant to stop bleeding, an anti-inflammatory to reduce swelling, and finally, an immunosuppressant to help aid in the transmission of pathogens. Therefore, it is no mystery why we're unaware when we have been bitten by a tick. What is important to know about Lyme disease in dogs? Lyme disease and other tick-borne disease testing is generally done as part of our annual heartworm prevention program annually in dogs 6 months of age or older. Lyme and tick-borne disease testing can also be done on an animal that has had an engorged tick removed. Please keep in mind that this type of testing cannot be done until at least 4 weeks after the removal of an attached and engorged tick. The important thing to know is that most dogs exposed to Lyme disease-causing bacteria appear to develop subclinical infections, and currently no treatment is recommended for this type of infection. Owners will be asked to monitor their dog for more chronic symptoms. Dogs with an acute infection may present with fever, shifting leg lameness, swollen joints, enlarged lymph nodes, lethargy, depression, and anorexia, and for those cases, antibiotic therapy is recommended. Chronic disease may be seen more rarely and is often associated with shifting leg lameness caused by transient, persistent polyarthritis accompanied by progressive joint changes. Protein-losing kidney disease leading to acute progressive kidney failure is very rarely seen. If a dog tests positive for Lyme disease, further testing may be recommended by your veterinarian in order to establish the appropriate treatment protocol. The reason I wanted to take a moment to mention Interceptor Plus is because of the new concerns about tapeworms that have been arising in Ontario. Please be aware that the most common types of tapeworms found in Ontario are not of a health concern for people. The identification of the tapeworm Echinococcus species in wild canids in Ontario over the last few years has raised some new health concerns for people. Unlike the other species, Echinococcus can be transmitted to humans where it can create serious disease. Infection in people is rare, even in endemic areas. At this point, you may be wondering why I took the time to mention Echinococcus. First of all, let's look at the route of infection. The route of infection for dogs and cats is through the ingestion of small prey animals or intermediate hosts like voles and mice that harbor the cyst stage in their body tissue. It can also be transmitted through infected tissue of larger animals like rabbits, moose, and sheep. Please be aware that humans cannot be infected through the ingestion of intermediate hosts or infected tissue. The route of infection to humans is through the ingestion of tapeworm eggs from the feces of infected animals. Okay, so we know Echinococcus can, in rare cases, cause serious disease in humans, and we now know its routes of transmission. So the final thing we need to cover is how to prevent an Echinococcus infection in people and pets. For people that work with a soil that may be contaminated by infected animals, we recommend that you should wear gloves, diligently wash your hands, and avoid getting soil in your mouth. It is also recommended to have your pet's feces checked at least annually by your veterinarian for any signs of parasite eggs. Pets infected with any type of tapeworm can be easily treated using an oral dewormer. To stop pets from becoming reinfected, you must remove pet feces from their environment promptly and then diligently wash your hands.
When dealing with the Echinococcus tapeworm, it is important to note that regular deworming may help control the infection in endemic areas, but it is not effective alone. For best prevention, we recommend that you pick up feces promptly and then wash your hands. Do not allow your pets to hunt or scavenge other animals, and keep dogs on a leash or in sight when they are out of doors. It is important not to let hunting or other dogs eat the entrails and internal organs of other animals.
What are some items you should consider when choosing a prevention product for the season? Top on our list include: where do you live? Do you live in an area that is endemic for heartworm or ticks? Where do you walk your dog? Do you like to go hiking in the woods, walking on trails, or do you stick mainly to the city streets? What activities do you like to do with your dog? Do you go hunting or hiking or camping, or does your dog spend most of the time indoors or as a couch potato? No judgment here. Other questions to consider would include: are you concerned about heartworm? Are you concerned about fleas? Are you concerned about ticks and Lyme disease? Finally, are you interested in using natural prevention products where possible? All of these will help you come up with the best decision for you and your pet.
The preventative products carried by Main Street for the 2023 heartworm season will be Interceptor, which is protective for heartworm and 3 intestinal parasites; Interceptor Plus, which is protective for heartworm and 4 intestinal parasites; Revolution, which is protective for heartworm and fleas, Credelio and NexGard, both of which are protective for fleas and ticks, Credelio Plus and NexGard Spectra, both of which are protective for heartworm, fleas, and ticks. Other products will be available by request. Interceptor is a pork protein flavor tablet that can be given with or without food. It provides prevention for heartworm disease, controls adult hookworm, and removes and controls adult roundworm and whipworm in dogs. It does not provide protection against fleas or ticks. Interceptor is indicated for use in dogs and puppies over 4 weeks of age and weighing at least 2 pounds. Interceptor Plus is a chicken protein chew tab that can be given with or without food. It contains the same protection as Interceptor with the addition of praziquantel for the treatment of adult tapeworms. It is indicated for use in dogs and puppies greater than 2 pounds and 6 weeks of age or older.
The next product in our lineup is Revolution. Revolution is a topical product that works for the prevention of heartworm disease and also works to kill adult fleas and prevent flea eggs from hatching for 1 month. So it is indicated for the prevention and control of flea infestations. It also offers treatment and control of ear mites and control of a tick infestation caused by the American dog tick. It only provides weak protection against other ticks as it does take several days to kill them and therefore is unlikely to prevent the transmission of Lyme disease.
It is possible to see ticks moving around on your pet even if you are using a preventative product, as tick prevention medication works through the transmission of medication from the pet to the tick when it bites and attaches during feeding. NexGard and NexGard Spectra have label claims for the reduction of Lyme disease as they kill greater than 90% of Ixodes scapularis, or the black-legged tick, within 48 hours before the infection can be transmitted and are effective for 30 days. Credelio and Credelio Plus are greater than 97% effective against labeled tick species within 48 hours after transmission and work for 30 days. Other tick-borne diseases are transmitted earlier in the feeding cycle, so infection may occur before the tick dies, but these diseases are not currently common in this geographical area.
Before I move on to the final 2 products in our prevention lineup for the season, I need to make sure that everyone is aware of the FDA warning for tick prevention medications. Tick prevention products containing the drug class isoxazoline have been associated with neurologic adverse reactions including muscle tremors, ataxia, and seizures in some dogs and cats. These effects may occur in animals without a prior history of neurologic conditions. Products containing this type of drug include NexGard, NexGard Spectra, Bravecto, Bravecto Plus, Credelio, Simparica, Simparica Trio, and Revolution Plus. More information on this can be found at the website listed at the bottom of the screen.
NexGard is a soy-based beef-flavored chew that can be given with or without food. It kills adult fleas and is indicated for the treatment and prevention of flea infestation. NexGard is used for treatment and control of black-legged ticks, American dog ticks, Lone Star ticks, and brown dog ticks, and work to prevent the transmission of Lyme disease as a direct result of killing black-legged ticks. NexGard does not contain prevention for heartworm. It is indicated for use in dogs and puppies 8 weeks of age and older and weighing at least 1.8 kilograms. Credelio is a pork protein chew tab that must be given with food or 30 minutes after a full meal. It kills adult fleas and is indicated for the treatment and prevention of flea infestation. It provides treatment and control of Lone Star, American dog, black-legged, and brown dog ticks, and works to prevent the transmission of Lyme disease as a direct result of killing black-legged ticks. Credelio does not contain prevention for heartworm and is indicated for use in dogs and puppies 8 weeks of age and older and weighing at least 1.4 kilograms. NexGard Spectra is a soy-based beef-flavored chew that can be given with or without food. It provides the same prevention properties as NexGard with the addition of prevention against heartworm disease and the treatment and control of intestinal parasite infections caused by adult hookworms, adult roundworms, and adult whipworms. It is indicated for use in dogs and puppies 8 weeks of age or older and weighing at least 1.8 kilograms. Credelio Plus is a pork protein chew tab that must be given with food or 30 minutes after a full meal. It provides the same preventative properties as Credelio with the addition of prevention against heartworm disease and treatment and control of intestinal parasites, including the adult and larval stages of roundworms. It is indicated for use in dogs and puppies at least 8 weeks of age and greater than 1.4 kilograms. There are other oral and topical preventative products on the market that you may have heard of, and these are available by special order. They would include Simparica, Simparica Trio, Bravecto, Bravecto Plus, Advantage 2, Advantage Multi, and Canine Advantix 2. The best way to control ticks and prevent your pet from getting Lyme disease is to perform daily tick checks and remove any ticks you find before they get a chance to attach. Essential oil sprays can be used as a natural deterrent for fleas, ticks, and mosquitoes. These should be applied liberally to dogs before walking in higher risk areas. Recipes for essential oil products are available in our parasite prevention library, and Herbacoat essential oil spray can be purchased in clinic. To see the product rebates available for this heartworm season, you can check out our product rebates available document in the parasite prevention library.
In closing, I wanted to take a moment to thank you for taking some time to review this presentation. We hope that it has answered any questions you may have on heartworm, fleas, and ticks, and has assisted you in making an informed decision on what prevention product is best for you and your animal companion. If you have any further questions, please refer to the articles in our parasite prevention library or reach out to one of our staff members. And most of all, stay safe and enjoy all Mother Nature has to offer this season.